Most of the world's adult population has a lifelong infection with the human herpes virus, most commonly herpes simplex type 1 or HSV1, or varicella zoster virus VZV. These viral infections often spread to the brain via nerve synapses along the axons of nerves or in the bloodstream. Once established in your brain, these viruses can wreak havoc, causing neurodegeneration and chronic inflammation. This may explain why the shingles vaccine significantly reduces your risk of developing Alzheimer's dementia, and why some studies show that taking antivirals to treat herpes simplex infections can decrease your subsequent risk of developing dementia. Let's examine one type of human herpes virus, HSV1. How can latent HSV1 infection affect your brain and contribute to the development of Alzheimer's disease? Hi, I'm Dr. Maria Conley, and we're going to just real quick take a look at Alzheimer's disease. It is the most common type of dementia, and its incidence is set to double in the next 30 years. It is due to the accumulation of misfolded proteins in the brain, specifically amyloid beta plaques and neurofibrillary tangles made of modified tau protein. Amyloid beta is often described as the trigger and tau protein as the bullet or executioner. Amyloid beta plaques congregate outside neurons and synapses, while tau protein forms the tangles inside of the neuron, which ultimately prove fatal. Without its communication network of neurons and synapses, your brain can no longer form memories and you develop dementia. So, how does chronic herpes simplex type 1 HSV1 infection contribute to this process? First, we know that HSV1 triggers amyloid beta accumulation by different mechanisms. Amyloid beta is thought to act as an antimicrobial peptide, or AMP, which is part of your body's initial defense against herpes simplex brain infection. It does this by trapping HSV1 viral particles and forming plaques as a defense mechanism. HSV1 DNA also directs your own DNA to make more enzymes that actually upregulate the formation of more amyloid beta plaque. HSV1 disrupts autophagy and lymphatic drainage, so your brain is less able to remove amyloid beta plaques, and these plaques tend to accumulate over time. HSV1 also triggers production of enzymes such as CDK5 and P38-MAPK that modify tau, causing this protein to go rogue and form tangles inside the neuron. Finally, HSV1 infection activates microglia, the local immune cells of your brain. They congregate at the site of infection and release several cytokines or inflammatory proteins such as IL-beta-1, TNF-alpha, and IL-6 that increase overall inflammation in the brain. Over time, this chronic neuroinflammation increases amyloid plaque deposition and neuronal death. Activated microglia eat up HSV1 infected neurons, but are unable to clean up the ever-increasing buildup of amyloid plaque in the brain. This leads to continued inflammation and more plaque deposition, which triggers more tau protein neurofibrillary tangles, which in turn causes more neurons and synapses to die in your brain. This is a self-sustaining loop of destruction in Alzheimer's dementia. The initial trigger is amyloid beta production, which leads to activation of microglia. These immune cells then release cytokines, which cause more inflammation. This in turn causes tau protein to become modified and misfold inside the cell, creating the deadly neurofibrillary tangles. This results in the death of brain cells, which then leads to more chronic inflammation and amyloid beta accumulation. This is a dynamic process of ever-amplifying brain damage that can ultimately result in Alzheimer's dementia. HSV1 contributes to this vicious cycle of neurodegeneration and neuroinflammation at several key steps. Although this is difficult to study in humans, autopsy studies have shown that HSV1 DNA is found in 90% of amyloid plaques in Alzheimer's disease brains compared to only 20% of amyloid plaques in those without dementia. HSV1 has been found in areas of the brain critical for memory and often affected in Alzheimer's dementia, including the hippocampus, amygdala, and temporal lobes. In transgenic mice studies, injection of HSV1 directly into the brain accelerated amyloid beta deposition and cognitive decline. Similar to human brains, the microglia of murine brains eat up HSV1 infected neurons but are unable to contain the spread of amyloid beta plaque deposition. Considering that most adults are infected with herpes simplex type 1 and or varicella zoster virus, what can be done to mitigate this risk factor? There are antiviral medications to treat herpes simplex infections, and there is some evidence that these medications may lower your long-term risk of developing dementia. We do have an effective vaccine for varicella zoster virus, which is recommended in all adults over age 50, even if you previously received the varicella vaccine as a child. Several preliminary studies have shown that this vaccine reduces your subsequent risk of developing dementia. Thank you for listening.